Data on race and the coronavirus is too limited to draw sweeping conclusions, experts say, but disparate rates of sickness and death have emerged in some places of US. According to data released by several states in big cities, highlighting what public health researchers say are entrenched inequalities in resources, health, and access to care. The statistics are preliminary and much remains unknown because most cities and states are not reporting race as they provide numbers of confirmed cases and fatalities. Initial indications from a number of places, though, are alarming enough that policymakers say that they must act immediately to stem potential devastation in Black communities. The worrying trend is playing out across the country, among people born in different decades and working far different jobs. There is Donnie Hoover, a judge from Charlotte, NYC, who could not shake a dry cough that arrived in March. On the south side of Chicago, LaShawn Levy, a medical assistant who rides the bus to work each day, turned to tea and cough syrup, everything your grandma taught you, to treat a headache and a cough. And in Detroit, Glenn Tolbert, a union leader for city bus drivers, was coughing so much that he got tested. This is a call to action moment for all of us, said Lori Lightfoot, the mayor of Chicago, who announced statistics of the outbreak in her city this weekend. African Americans account for more than half of those who have tested positive and 72% of virus-related fatalities in Chicago, even though they make up a little less than a third of the population. Those numbers take your breath away, they really do, said Mrs. Lightfoot, who is the city's first Black woman elected as mayor. She added in an interview that the statistics were among the most shocking things that I have ever seen as a mayor. In Illinois, 43% of people who have died from the disease and 28% of those who have tested positive are African Americans, a group that makes us a total of 15% of the state's population. African Americans, who account for a third of positive tests in Michigan, represent 40% of deaths in that state, even though they make up 14% of the population. In Louisiana, about 70% of the people who have died are Black, though only a third of the state's population is. North Carolina and South Carolina have reported a ratio of Black residents to white residents who have tested positive for the virus that well exceeds the general population ratio. Black people are overrepresented among those infected in the Las Vegas area and among who have tested positive for the virus in Connecticut. In Minnesota, Black people have been affected with the coronavirus at rates roughly proportionate to their percentage of that state's population. For many public health experts, the reason behind the disparities are not difficult to explain, the result of long-standing structural inequalities. At a time, the authorities have advocated staying home as the best way to avoid the virus. Black Americans disproportionately belong to the part of the workforce that does not have the luxury of working from home, experts said. That places them at high risk for contracting the highly infectious disease in transit or at work. Mrs. Levy, the medical assistant from Chicago who fell ill, thinks that her daily bus ride to work could have been the source of exposure. Or, she said she could have picked it from the hospital where she works, at the grocery store, or from food served to her. I'm not just sure, said Mrs. Levy, 45 years old, who has asthma and high blood pressure. This current crisis lays out what we have known for a long time, which is that your zip code is often a determinant of your health outcome, said Dr. Mandy Cohen, Secretary of the North Carolina Department of Health and Human Services. Judge Hoover, the Mecklenburg County Superior Court judge who has tested for the virus, is 70 years old. His wife, Josephine, has also tested for positive. He was receiving chemotherapy for multiple myeloma and she has diabetes, underlying medical issues that put them at high risk of severe illness. So in conclusion, we can say that the rate of the Black Americans getting infected with the virus and getting tested positive for this virus is disproportionately very high compared to the white Americans. This is obviously very alarming for all the Black Americans who are staying in the US. This is all for today. See you on the next video. Stay safe.